Welcome to the deep dive. Today we're going to try and cut through some of the medical jargon. We're talking about understanding your liver blood tests.
Yeah, it sounds complicated, but it doesn't have to be. We've been looking at a really helpful guide from Blood Test UK. They actually offer these kinds of tests right here in Sale and across Greater Manchester. They're doing it for over 3 years now.
Oh, right. Locally, then.
Exactly. And our goal today is pretty simple. We want you to understand what these tests are really measuring and why catching any potential issues early on is such a massive advantage for your health.
Okay, let's break it down then. So a liver blood test. It's basically checking how healthy your liver is by looking at specific things in your blood, like liver enzymes.
That's the main thing, yes. Think of enzymes as tiny chemicals the liver uses or makes. These tests are often called liver function tests, or LFTs.
Right, LFTs. I've seen that. And
the key things they measure are usually chemicals with names like ALT, AST, ALP, and also something called bilirubin.
Okay, ALT, AST, ALP, bilirubin. Got it. So what do those actually tell us in simple terms?
Well, think of that like this. If those chemicals, especially the enzymes like ALT and AST, are too high, it's like a warning light flashing.
A warning?
Yeah, it often signals that the liver might be a bit hurt, maybe inflamed or damaged somehow. On the flip side, if other things they measure, like a protein called albumin, are too low, that could point to a more long-term chronic problem.
So it's like a map for the doctors then, based on these levels.
Exactly. It guides them. And this is the kind of detailed insight you get from resources like the guide provided by Blood Test UK.
Okay, so that brings us to the really important part. Why should you actually care about getting these tests? What are the big benefits?
I think this is the crucial point. The single biggest benefit is finding problems before you feel sick. Your liver is, well, pretty stoic. It often doesn't complain until things are quite serious.
So these tests can be an early warning system.
Absolutely. They can help catch really significant conditions like hepatitis, which is inflammation, cirrhosis, that's serious scarring, and something increasingly common, fatty liver disease.
And finding those early, that makes a difference.
A huge difference. According to the information from Blood Test UK and general medical understanding, spotting these diseases before symptoms really kick in gives you a much, much better chance of treatment working well. It improves outcomes significantly.
Okay, that makes sense. So if you're going to get tested, what do you need to do? Is there any preparation involved?
Yes, usually there is. To get the clearest, most accurate results, you'll likely be asked to fast.
Fasting means no food.
Right. No eating or drinking anything except water, typically for at least 8 hours before the blood draw.
8 hours. Why is that so important?
Well, because eating can temporarily affect the levels of some of those enzymes and other things they measure. Fasting gives a baseline, a truer picture of what's going on.
Makes sense. Anything else?
Oh, definitely tell the doctor or the clinic about any medicines or even supplements you're taking. They can also influence the results, so it's important they know the full picture.
Good tip. And for people listening in Sale or nearby in Greater Manchester, how easy is it to get these tests done?
It's pretty straightforward. Your GP can arrange them, of course, but as Blood Test UK points out in their guide, private clinics are also an option.
And the advantage there might be speed.
Often, yes. Private clinics can sometimes turn results around much quicker, maybe even within 24 hours in some cases. So that's something to consider if you need answers fast.
Okay, so wrapping this up, what's the main takeaway here?
I'd say regular testing, maybe think about it once a year or as your doctor advises, is like giving your liver a regular checkup, like a report card.
A report card for your liver, I like that.
It helps you and your doctor manage any existing conditions. Or it empowers you to make important lifestyle changes if needed. Things like maybe cutting back on alcohol, improving your diet, managing your weight, stuff that really protects your liver.
And if the tests do show something's up,
then your doctor has that crucial early information. They might suggest follow-up tests, perhaps something like an ultrasound scan, to get a visual look at the liver.
Right, to see what's going on.
It's all about being proactive. Knowing your numbers, those key markers like ALT, AST, albumin, empowers you to take action for your health.
We know that being proactive significantly boosts patient outcomes, reducing the risk of serious chronic liver disease down the line. So maybe the question for you listening is, when did you last check in on the health of your body's hardest working internal organ?
It's a really important question. Knowing those numbers is the first simple step towards looking after it properly.
And this deep dive, exploring what those liver tests mean for you, was guided by the expertise and information provided by Blood Tests UK.